All right, good afternoon, everybody. My name is Katie Naples Mitchell. I'm the program director of the Program in Criminal Justice Policy and Management here at Harvard's Kennedy School. And we're so delighted to have you all joining us this afternoon for the next event in our special topic spring speaker series featuring David Showalter, who we are really excited to have present his research. They are currently a postdoctoral fellow in the Harvard Sociology Department, and beginning in July 2023 will be Assistant Professor of Sociology at Harvard University. David uses ethnographic and qualitative methods to investigate how place, social networks, and organizations influence health, criminalization, and marginality, particularly with respect to drug use and drug policy. David's first book project is a multi-site ethnographic study of opioid use and opioid-related services in Backcountry, California. Their research has been published in Social Science and Medicine, Theory and Society, the International Journal of Drug Policy, Mobilization, and elsewhere. And David holds a PhD in sociology from the University of California, Berkeley. Before we get started with David's presentation, just wanted to give a little bit of housekeeping for this event. Like all of our events, this event is open to the public, and we encourage audience participation. David is going to give a presentation for about 45 to 50 minutes, and then we will open up for questions. But if people have engagement, offerings, links to throw in the chat, or anything at any time, please feel free to do that, and then we'll take those questions at the end. And our next event is on April 12th. It is a continuation of our parole speaker series this semester, which is a focus this time on presumptive parole in the state of New Jersey with 2 members of the New Jersey Office of Public Defender. So please come back for that. This event is being recorded, and we will be posting it to our YouTube channel and our website after the fact. And with that, I will let David take it away.
Well, good afternoon, everyone. It's really wonderful to have the chance to share my research with you today. And thanks so much to Katie for introducing me, and to Professor Sandra Smith for inviting me to present, and to Brian Welch for his help organizing my presentation today. So let me share my slides and then I'll get started. So today I'll discuss findings from my dissertation research on opioid use and opioid-related services in rural California, and I'll be specifically talking about small-town policing and its effects on the health and safety of people who use drugs. And I'm really looking forward to your feedback today, since this is kind of work in progress. So I'll start with a bit of context for why policing and punishment are important for understanding rural opioid use. As many of you likely know, opioid overdose rates in the United States have been rising for decades with no end in sight. Over 106,000 people died of drug-related causes in 2021, most of them involved in opioids. And a crisis that was initially driven by prescription opioids has shifted over the past 10 years toward illicit opioids like heroin and fentanyl. The overdose crisis has affected virtually every region of the United States, including large cities, suburbs, and rural areas, and rural overdose rates actually surpassed urban rates until the transition to fentanyl. And opioid use and overdose in small towns and rural areas with predominantly white populations have received more sympathetic media coverage than past drug crises that disproportionately affected Black and Latinx people in large cities. And some predicted that the ethno-racial and spatial characteristics of the overdose crisis would also mitigate punitive policy responses in favor of therapeutic approaches, such as harm reduction programs like syringe services that prevent the spread of disease, programs that distribute the opioid overdose reversal drug naloxone, and medications for opioid use disorder like methadone and buprenorphine. And the urgent need for these services in rural areas has been tragically illustrated by large outbreaks of HIV and other diseases. But while access to harm reduction and treatment services has expanded somewhat in rural areas, punishment has not abated. In fact, rural incarceration rates continued to rise throughout the crisis, even as they plateaued and fell in large cities and suburbs. You can see this trend on this chart from the Vera Institute of Justice, with the rising red line representing rural pretrial incarceration rates. You can also see it in this table from another Vera Institute report, with prison admissions in almost every state rising in rural areas, denoted by red figures, while falling in large cities. To be clear, I'm not setting out in this presentation to explain this temporal trend, but this unexpectedly punitive rural context led me to ask how small town law enforcement officers perceived and responded to drug use, and how policing affected the health and safety of people who use drugs in rural areas. So I'll first describe the social and organizational predicament faced by small-town law enforcement officers and their targets, and then introduce the concept of acquainted marginality to capture its important features. I'll describe my data and methods and then zoom in on one small town that I call Sage Flats to show how acquainted marginality shapes small-town policing and its effects. And then I'll close with some implications of my findings for how we should address drug use in rural places and elsewhere. So I'll start with a simplified comparison between big cities and small towns. Big cities feature large and dense populations administered by large bureaucracies. Almost all city residents are strangers to one another, including local authorities who are personally acquainted with very few of their constituents, particularly those from marginalized groups. And as a result, face-to-face relations, or what sociologist Irving Goffman called the interaction order, relies more on impersonal norms. So as my colleague Robert Sampson put it in his landmark book, Great American City, because, quote, there are simply too many people to know in the city, community efficacy does not require that neighbors or local police officers be one's friend. Now, by contrast, small and remote towns have, by definition, small populations administered by correspondingly tiny bureaucracies. Dense and multiplex ties in which social roles coincide are more common, significantly reducing public anonymity. Local authorities frequently grow up with and live alongside the people that they govern. And as a result, interaction relies more on personal familiarity and trust than it does in large cities. Small town police departments reflect these social and organizational differences. So most police departments in the United States are in small towns, 70% administer fewer than 10,000 residents, and nearly half of all departments employ fewer than 10 full-time equivalent sworn officers. And compared to departments in cities of 1 million or more people, small town departments have fewer resources and are less professionalized. They have about half the budget per sworn officer, they require about half the hours of training for new recruits, and they employ fewer detectives and other specialized investigative personnel. Dense and multiplex social ties also affect the work of rural law enforcement. So in a study of rural drug policing in West Virginia, anthropologist William Garriott reported that many people on probation were former classmates of their probation officer, while a local pharmacist relied more on her personal social ties than state databases to monitor illicit drug use in her community. So I coined the term acquainted marginality to capture this set of social conditions and their effects on policing and drug use. As I said, small and remote towns feature higher density of acquaintanceship, meaning the proportion of residents who are personally known to one another. And in his study of behavior in public places, Goffman argued that acquaintances are permitted and even obliged to interact with one another when they encounter each other in public. So authorities can manipulate this prerogative as a pretext for informal interrogation, using ostensibly benign inquiries to uncover compromising information. And social ties between law enforcement and the people they police also blur the boundaries between gossip among neighbors and snitching to outside authorities. So the combination of geographic isolation and dense and multiplex ties, including between powerful and marginalized residents, generates acquainted marginality. And I argue that acquainted marginality can augment the diminished organizational capacities of small town police departments and can intensify surveillance and stigmatization of people who use drugs with negative effects on their health and well-being. From spring to 2017 to spring 2019, I conducted in-depth interviews with approximately 130 local officials and approximately 70 people who use drugs in a total of 12 urban, rural, and remote counties, and observed members of both groups in a subset of 5 counties. I attended work meetings, conferences, service sites, and I also observed people selling, buying, and using drugs, as well as other everyday activities. And I entered the field with almost 10 years experience providing harm reduction services in Chicago and California, which helped me build rapport with people who use drugs in the places that I studied. Today, I'll focus on one small and remote town that I call Sage Flats. My interview participants in Sage Flats included 24 professionals in healthcare and public health, law enforcement, and the criminal courts and substance use treatment, as well as 15 people who use drugs. And the people I interviewed were almost all white, comparable to the county's overall population. They included slightly more men than women, and they were relatively old, again, broadly reflecting the county's residents. And I use pseudonyms for all people and places, and I've masked or altered some identifying details. Sage Flats is a town of a few thousand people set in a sparse expanse of farmland, scrubland, and forest. It's a long way from nowhere, as the sheriff put it to me. The streets are wide, the buildings low, the shop signs faded and peeling. And while logging was once a major local industry, lumber production has fallen to a fraction of its mid-20th century peak. And relative to the rest of California, Sage County's median household income was low and its unemployment rate was high. Sage Flats was administered by a tiny crew of legal officials in the area, including a handful of judges, prosecutors, defense attorneys, and probation officers, and a small group of professionals and practitioners, including a handful of healthcare and substance use treatment providers, and one main nonprofit human services agency. Most of their offices were located within a few blocks of each other. So I'll start by describing how people bought, sold, and used drugs in Sage Flats. So illicit drugs were typically brought to town by people who used them from several mid-sized cities that were 1 or 2 hours away by highway. They were typically sold through networks of friends and extended family as a means to support personal use, as Jonathan, a man in his 20s, explained to me. Quote, "There's people that want to use drugs and they need more. It's like the concept of a carpool. The person willing to drive, that's just about it. Their reason could go from I lost rent to my kid needs diapers and my older kid needs money for a field trip, could be gas money. I haven't seen anybody that sells drugs here for a living. As a result, the local drug supply was limited and inconsistent, and prices were high, sometimes twice what was typically paid in the city." So Jonathan continued, "This town gets spun up, heroined out, pilled in, and jacked up, but it's so thin of a market that sometimes you can only get up to a $20 bag. There's no like, I can go to the corner and get a ball or 1/8 of an ounce, as one could in an urban drug market." And as in many other rural areas of California, prescription opioids were widely prescribed in Sage County during the 2000s and 2010s, some years up to twice the statewide rate. And healthcare providers blamed overgenerous prescribing in part on the dearth of local options for more comprehensive treatment. So a physician assistant named Josh told me, "We don't have hospice, we don't have any type of visiting nurses. We have fair mental health care, I think, but for the type of problems we have, it's inadequate. People can't go on dialysis here. They have to go to another city 3 times a week, just like an 1.5-hour drive away." And as a consequence, many of the patients that Josh and other providers saw had been prescribed high doses of opioids and other strong medications for years. One prolific prescriber had recently passed away. Josh inherited many of his former patients. And while Josh was often willing to continue or slowly taper opioid prescriptions for older patients diagnosed with painful conditions, he refused to prescribe opioids for younger and healthier patients. And Josh was not alone in setting strict limits on opioids in the wake of the overdose crisis. So when I asked the town's senior physician who directed the local clinic how many patients he started on new opioid prescriptions, he smiled and curled his hand into a 0, quote, "unless you've got bone sticking out," he said. And in a town as small as Sage Flats, changes in a few providers' practices could have significant population level effects, and prescription rates dropped precipitously during the 2010s, shrinking the supply of pills available to buy and sell. And aside from drugs themselves, injection equipment was also hard to get. There was no local syringe services program, and though syringes can be purchased without a prescription in California, the town's pharmacists refused to sell them to people they suspected of using drugs. So people told me that they routinely saved and reused syringes with serious risks to their health, including abscesses and needles breaking off while inserted. Some people tried to obtain, distribute, and dispose of new syringes on their own as a means of informal harm reduction, including a woman in her 30s named Alex. Sometimes they would purchase syringes from urban pharmacies and bring them back to share with others. Quote, "I would go buy a couple boxes of syringes, and then if anybody needed them, I'm more than happy to give them to people. I had a couple friends that would pretty much do the same thing. We would actually seek people out and ask them if they needed them because we knew how scarce they were around here. Drug sales and use in Sage Flats typically took place in private homes rather than semi-publicly, as in many large cities. And some homes, including that of a man in his 50s named Ray, were hubs of the local drug scene. So Ray grew up in Sage County. He left for a time, then he moved back to look after an elderly parent. And several times a day, he injected opioids, often mixed with methamphetamine. A man named Mark, who also grew up in the area, lived down the block from Ray. Mark did not inject drugs, but when he learned that people were doing so in Ray's home, he started purchasing boxes of syringes from the pharmacy, which he gave to Ray, who in turn exchanged them with his friends for their used equipment. Ray would give the used syringes he collected back to Mark, who would toss them into his fireplace as a makeshift incinerator. And though small and limited, this effort at informal risk reduction resembled early harm reduction programs in cities, which were often started in the 80s and 90s by people who used drugs and their peers as vehicles for grassroots mutual aid or overt civil disobedience. But in Sage Flats, their efforts were sometimes hampered by fraught social relations in the tiny drug scene. So Ray's central position helped supplies reach more people, the people that came to his house, but that also lent him influence over other people's drug use. So Alex once explained to me her ambivalence about his role. She said, I think it's kind of cool that Ray got into this needle exchange thing, but I don't know, he's kind of weird about it too. He uses it more like a power thing. Ray's the type to where if you don't have something, he ain't gonna answer the door. So now it's kind of like, well, if they're wanting needles, I know they've got something like drugs. And for his part, Ray didn't deny that he received fringe benefits for providing syringes in a private place for people to use drugs. I get fringe benefits, yes, I'm not gonna lie. When people come over, they'll kick me down something, or they'll bring me a pack of cigarettes and a Pepsi, you know? Now, urban segregation often concentrates illicit drug markets in poor Black and Latinx neighborhoods, and thereby reduces the visibility of drug use to middle and upper class urban residents. But officials and service providers in Sage Flats told me the town was too small for any residents to insulate themselves from the issue. So Josh, the physician assistant, who had also worked in urban areas, told me he was struck in Sage Flats by how much more apparent drug use was to him in everyday life. Quote, smaller towns probably have more of a problem, it seemed to him, just because it's so concentrated, meaning all the residents are concentrated in a small area. Quote, I think the bigger cities have it too, but it's not as in your face as much. And a member of the district attorney's office concurred, quote, there's not like good neighborhoods and bad neighborhoods here, so it's kind of intermixed. So sometimes I feel like you think the crime problem here, drug problem here is worse than it actually is because you have to see it every day. Even if you're in a so-called good neighborhood, a block away, they're trying to be a drug dealer. You can't segregate yourself, you know? And they continued, quote, we get a lot of people who seem to think crime is like outrageous here. I'm like, well, not really. We're doing a lot better than a lot of places, but you can't escape it here because it's small. And these perceptions of rampant crime and drug use often led residents to demand forceful responses from law enforcement. But law enforcement agencies in Sage County were hindered by limited personnel and resources. So when I visited the police headquarters in summer 2017, the police chief explained to me, we were sitting at a folding table in the vacant city council chambers. I explained that only a few of his department's 10 or so officers were on duty at any given time, while the rest of the county's outlying villages were each patrolled by one or two sheriff's deputies who were typically residents of the area. And the region's roads were also monitored by a small command of the State Highway Patrol. But recruiting officers for all of these agencies was difficult because of the area's low pay, limited amenities, and remote location, leaving the police and sheriffs perennially understaffed. And with so few co-workers, all officers were forced into generalist roles, no matter their rank, as the area's highway patrol commander explained. Quote, I could be handling the front desk because that officer may be tied up with a car seat appointment or verifying the VIN on a vehicle or something like that. And then the next moment I could be out heading up a scene. We're a 24/7 operation and I can't work my sergeants 24/7. So there are times where I don't have a sergeant and I've got to fill that role. Limited personnel made it difficult to devote staff time to investigative work, which frustrated the Sage County District Attorney, who previously worked in an urban prosecutor's office. Quote, "We don't have a DIC bureau or a detective unit. We can't take fingerprints. The quality of the investigative work we do is a joke. When I was in the urban DA's office, you did fingerprint stuff all the time. All the years I've been here, I have not seen one single fingerprint lifted. I don't even think the guys know how to lift a fingerprint." But Acquainted Marginality helped law enforcement compensate for these organizational weaknesses through increased opportunities for informal surveillance and information gathering in the course of everyday life. So first of all, officers often knew and lived near their targets. Alex's mother, Rhonda, who also used drugs, reminded me that Ray's neighbor was once chief of police, quote, or I guess he was a former sheriff, my mistake. He lives right across the street from Ray, come on. Ray's security camera points at his house and he points at Ray's house. They watch each other's property, you know, just friendly neighbors, she added sardonically. And I asked Alex if she thought the police knew the extent of drug use at Ray's house, and she was adamant, of course they do. How can they not, you know? There are the people that come and go. Ray will go and tweak out on his yard in the middle of the night all night long. It's really funny. It's like, how could they not know? And law enforcement officials confirmed their informal knowledge of criminal suspects. So the Sage County Sheriff agreed and told me, quote, "We know who the players are. These people stick out like a sore thumb." Long-term familiarity gave officers granular personal knowledge about criminal suspects' lives and activities, as a juvenile probation officer who grew up in Sage County explained. Quote, "Part of the perks of a small town is that I know a lot about these kids already, or their families. So a lot of the kids I get on my caseload, I've been hearing about for the last 5 years as they go through the school system." Encountering clients around town also helped the officer keep closer watch on them, but it made it difficult to separate work time and personal time. Quote, "I don't want to know what that person at the store is buying sometimes," they complained. Quote, "If I see an adult and I know they're not supposed to be getting alcohol, sometimes I just don't want to know because I just want to be off work." Social and physical proximity to their targets also complicated law enforcement's ability to use the information that they collected. So the sheriff described how, in contrast with urban departments, recognition of law enforcement by members of the public limited the kinds of investigations they could pursue. In a large city, you can drive a different car the next day, put different people in it. We start working on those people, we start trying to put surveillance on their residence, it doesn't work because they know everybody. They recognize the police cars, they recognize the officers. We live amongst each other. And the district attorney agreed that Acquainted Marginality allowed him an up-close view of criminal defendants' lives to their benefit or detriment. Quote, "I'm on a first-name basis with probably 80% of defendants. You're back, how you doing? You know, they come up to me, they shake my hand, whatever, how you doing? Or I'm sorry, I'm really gonna straighten out. I'm like, yeah, sure you are, buddy." Close relationships among and between local officials and their clients and constituents increased opportunities for informal surveillance through information sharing among officials and could intensify the stigma and reputational damage experienced by people who use drugs. So the power of interorganizational links in a small town can be clearly seen in the Sage County Drug Court. The drug court team included the county's head judge, district attorney, public defender, 2 probation officers, a treatment counselor from the county behavioral health department, and at least 1 law enforcement officer, as well as a case manager from the town's nonprofit social services agency. And because the county's governmental and service offerings were so sparse, virtually all defendants were obligated to meet and interact with these organizations and often these specific officials and providers. As a result, the drug court team members personally knew many of the people that passed through the court system, and as the probation officer said, had often heard about or interacted with them for years before they formally entered the drug court program. Conflicts of interest were inevitable and, with few substitutes available, often unavoidable. So, for example, a judge told me that in 20 to 30% of his cases, he knew at least one party well enough that if he lived in an urban county with more judges, he would recuse himself. Meetings of the drug court team allowed these deeply embedded officials to pool their knowledge about defendants and their families and associates. The court accepted fewer than 10 participants at a time, and completing the program could take many months. Participants were required to attend regular hearings, take courses on topics such as anger management and driving under the influence, and attend self-help and treatment sessions, some of which were led by drug court team members. And with few openings, decisions to admit new participants often turned on team members' perceptions of defendants' personal character and readiness for the program in the longer-term context of their substance use. Team members kept track of participants' family and intimate relationships through direct observations around town and the circulation of gossip. So they'd sometimes introduce information that was not formally part of a participant's case file, such as drug use that had not been detected by urinalysis, or a new relationship that had not been disclosed. For instance, by saying vaguely, "I heard she might be using more than cannabis," or sharing stories that they had heard from others who had allegedly observed defendants behaving badly. Drug court participants were also acutely aware of their own exposure to the gazes and judgments of their neighbors. On one occasion, the drug court team decided to arrest a participant during the session for repeatedly missing appointments and program requirements. And after the session ended, as the bailiff prepared to transport her to jail, she complained through tears to a probation officer about the unintended consequences, social consequences of being arrested. The sheriff's office regularly posted the names of those booked into jail on social media, the jail being so small that they could feasibly do that on a regular basis. The defendant said that her mother would likely check for her name. And in this small town, she continued, rumors would immediately spread that she was using illicit drugs again. And though this person allegedly used cannabis, but that substance was legal for medicinal and recreational purposes in California, and the drug court team had not yet agreed on a consistent policy for participants. Propinquity between court officials and defendants seemed to encourage leniency in some cases. So some officials complained that one judge was more generous to defendants whom he had watched grow up, for instance. That judge's family had also long been prominent in Sage County, and I also suspect that he was conscientious of his reputation as a benevolent local leader. But for other officials, social intimacy with defendants seemed to stoke intense stigma and even contempt. So for example, the district attorney did not hide his disdain for his constituents who used drugs. Quote, "If you want to get addicted and die, I don't have a problem with it. We've had a number of deaths here, and I don't find any of them to be tragic. A lot of people seem to get up in arms over adult opioid use. I'm like, let them use, give them more. Maybe they'll croak and they'll get off SSDI and Social Security won't get bankrupted after all. It's a terrible thing to say, but it's the truth, because most of the ones that die of opiate overdoses are complete derelicts. They're not contributing." Being older, Ray had seen how durable negative reputations could be in a small town. So he told me, quote, "They label make you. If you've been here all your life and they label you, that's it. I left for a few years, came back and had the same label, even though that wasn't how it was anymore." One evening, I was at a bar in Sage Flats, sitting a few seats down from a former district attorney. Tending bar was a woman who had served Ray and me on a different evening several months earlier. Now that I was alone, the bartender took the opportunity to inform me that Ray, quote, "is not welcome here," and warned me about hanging out with, quote, "the wrong kind of people." And the prosecutor chimed in, "Ray's been dealing for 30 years. He was a piece of work when I was the DA." The bartender lamented, "It's sad. At one point, Ray was somebody's kid, and now nobody would care if he was killed, and they found him in the middle of Main Street." People with ruined reputations were sometimes pressured to leave town altogether. One woman who used drugs showed me an email from the district attorney to her defense attorney offering to resolve her multiple criminal cases on the condition that she purchased, quote, "a flight out of here." Quote, "The only reason she's getting less time," the DA wrote, "is based on the promise that she'll leave. So I want to make sure she has time hanging over her head as an incentive to actually get out of town. This way, if she doesn't actually leave, as others have done in the past, I still get the jail time." The allusion to similar deals indicates that this was not an uncommon strategy to deal with repeat offenders. So finally, I'll mention some of the effects of acquainted marginality on the implementation of healthcare treatment and harm reduction services and their use by people who use illicit drugs. So in California, as in some other states, harm reduction services were historically authorized by local governments and operated by nonprofit agencies or volunteers. While authorization and funding for harm reduction services have expanded in California and in other places during the overdose crisis, including in rural areas, programs still often rely on committed local volunteers and service providers and are regularly threatened by political and legal opposition. In some rural counties I studied, empathetic personal relationships between elected leaders, service providers, and people who use drugs help foster support for harm reduction services as a component of local responses to the overdose crisis. But with few residents, the potential pool of empathetic officials in rural places is smaller. Each individual official is more influential, and there are fewer alternative sources of support for such programs if those relationships do not develop or if they sour beyond repair, which unfortunately seem to be the case in Sage Flats. So Mark, being a person who didn't use illicit drugs and did not have a particularly spoiled reputation in town, initially attempted to drum up official support for harm reduction services by directly contacting local officials. But he received either no response, ambivalence, or in the case of the district attorney, open hostility, as the DA later told me. Quote, I got a phone call from a guy and he wanted to do a needle exchange. And I said, I'm not going to support it. I told him, I said, look, I think when you take away the consequences of a particular conduct, you get more of it. And if the consequences are the spreading of disease, I think that consequence needs to be there. Ray's reputation as a public nuisance also prevented him and Mark from partnering with the county health department to deliver harm reduction services more widely and effectively. When I broached the topic with two staff members of the department, they grimaced and admitted that Ray and his friends, quote, would not be people that we want having control of a program. Alex was also intimately familiar with the consequences of acquainted marginality and felt as though she was trapped in a web of surveillance that extended into ostensibly safe and therapeutic settings like healthcare. For example, she recalled being arrested after a visit to her doctor's office. Quote, my doctor called the cops on me. I didn't know he knew I even had a warrant for not going to court, but like I was getting a checkup and he said something about the cops. But it didn't click until I was leaving, and then all of a sudden I was swarmed by cops. So I was like, everyone's a cop up here. It's like even the doctors are cops, I swear. Being pursued by law enforcement made it harder for Alex to use drugs safely and help others do the same. So one summer day, I visited her at a friend's home where she had been staying on a mattress in the corner of the living room floor. She told me that she'd been arrested 3 times in the course of 1 week, including for possessing syringes she received from Mark and Ray. And showing me her most recent citation, she remembered with contempt the officers questioning why she had so many new syringes. I flat told them, you know, everybody in this town will sit in a circle and share the same needle. What's wrong with giving somebody a new one when they need it? So yeah, I have them on hand when people need them. I'm not going to keep that a secret. I'm proud to say that. Nevertheless, she was charged with possession of drug paraphernalia. And I should note that syringes that are received from harm reduction programs and several other categories of syringes, other providers of syringes in California, are exempted from the state's paraphernalia statute, though it's often difficult to argue that point in the case of arrest. Many of Alex's family members and loved ones had had encounters with Sage County law enforcement. So when we spoke on the day in question, her child was in juvenile detention as well. And she told me, quote, I guess it depends on what your last name is around here. And hers, she felt, had been irreparably tarnished. So I'll close by summarizing what these findings suggest about how we should address drug use and its consequences in rural areas. Acquainted marginality and the extension of domination through dense and overlapping social networks is an important dimension of police power and social control, especially in insular or isolated places. Because law enforcement officers in such places tend to live among those they administer, they inevitably collect information in everyday life about potential suspects. And I think it's unrealistic to expect them to either avoid or ignore such information or to not opportunistically bring it to bear in their police work, especially given the formal resource constraints under which they operate. However, there are steps we can take to mitigate the negative consequences of acquainted marginality on the health and safety of people who use drugs. So harm reduction services, for instance, are cost-effective and backed by an expansive body of scientific evidence. And though they have spread to some rural areas, they should be available universally as basic public health services. And rather than being dependent on local initiative and approval, which leaves them vulnerable to local opposition and animus against people who use drugs, like what I documented here, harm reduction services should be universally authorized, funded, and implemented on a state or regional basis in collaboration with local officials and, importantly, with people who use drugs, who are going to be the experts on how syringes should be distributed so that they reach the most people and so that the most people are going to be willing to take advantage of the program. Doing so would help reduce geographic disparities in access that are reinforced by local control over these health services. Anti-drug stigma in the United States is longstanding and strong, and I argue it can be intensified by acquainted marginality. And though we should obviously pursue a range of efforts to reduce stigma against people who use drugs, we should also decouple social stigma from its most harmful consequences for health and safety, namely criminal sanctions and incarceration. As I've shown, acquainted marginality can convert gossip and everyday interactions among neighbors into criminal evidence. The link between personal reputation and risk of arrest and incarceration can discourage people who use drugs from seeking healthcare treatment and other services. So during my field work in Sage County and elsewhere, I heard stories of people avoiding emergency care for overdoses, and I watched people manage large wounds at home rather than go to the hospital because they feared the consequences of seeking help for their drug use. Relying on incarceration can also contribute to opioid overdose rates. So most people who use opioids who are incarcerated return to use with reduced tolerance soon after being released, putting them at extremely high risk of overdose. In some studies, dozens or even over 100 times or more higher than the general population in the first 2 weeks post-release, a critical period. One recent study in Indiana by Grant Victor and colleagues actually found that each additional jail booking was associated with increased overdose risk. So aggressive policing and punishment can actually be counterproductive to keeping people who use drugs alive. I'll conclude by returning to the first graph that I showed. A central reason why overdose rates have continued to rise is because of transformations in the illicit drug supply. In many places, fentanyl is now the primary or only opioid available on the street, and it's often sold as heroin or as counterfeit pills. Fentanyl is more potent than other opioids, and when it's cut with other substances, it can be difficult to dose consistently. Its potency also makes it easier to smuggle, which limits the efficacy of enhanced enforcement and interdiction efforts. Drug market experts agree that strong synthetic drugs like fentanyl will continue to dominate US drug markets. Most people who use opioids, though, do not want treatment, and many do not want to quit, but they often have no alternative to fentanyl and other dangerous unregulated drugs. If our goal is to prevent people who use drugs from dying, which is necessary for them to receive any other services, treatment or otherwise, we'll ultimately need a safer, regulated drug supply. Clinical programs and community-based organizations in other countries, including Canada, have demonstrated ways to offer tested and regulated alternatives to street drugs. These efforts deserve serious attention if we are to address the root causes of the overdose crisis. Thank you very much for your attention. I really look forward to your questions.
Phenomenal. Thank you so much, David. We've already got some excellent questions from Josh Dankoff in the chat. And the way we usually like to do this is to have people ask their own questions as much as possible. So I'm going to let Josh start with those questions. I know there's a series of them, so you can take them one by one.
Thanks so much for the presentation and research, really compelling ideas. And if there are other questions, Katie, you can decide to not answer all three, but I'll put out all three right now.
Sure.
I'm curious the extent to which the changes in the marijuana legality in California and also the resulting collapsed market, which has shifted a lot of the dynamics in certainly Humboldt County and Mendocino County. I don't know where you purposely didn't tell us where your research was taking place. So I'm just curious how that impacted your work and the dynamics on the ground? That's the first question. There are some places in California that have really active tribal courts, and I'm curious whether this idea of acquainted marginality applies there, or if you can even say that it applies there, both in California and elsewhere. And finally, and this is purely selfish because I'm working on this question, curious about if GPS and electronic monitoring was in use for people who are having issues with drug addiction. That's something that we do see here in Massachusetts, and well, not great outcomes, not in my personal opinion, but I'm curious how that works where you were researching. And thanks so much.
Thank you, Josh. 3 really great questions, and I'll do my best to answer all 3 efficiently. So the first question about changes in the cannabis market. I'm not an expert on these topics, so I would defer to them. But what you described is definitely that dynamic of legalization and the collapse of cannabis prices in the illicit market, and therefore opportunities to work in the illicit cannabis market. It's definitely a theme, not just in the sort of Emerald Triangle, but throughout California. There's a lot of illicit cannabis growth all over rural California. And that's definitely what I can speak more to kind of how I encountered that narrative in the field and how it changed people's perceptions of their communities. So on the one hand, in places where cannabis had historically been a big part of the local economy, for better or worse, it obviously put a lot of fear into people's hearts, whether they use drugs and were directly connected to the industry or not, just in the sense that there is often not a clear alternative industry in rural communities. There was also a sense that the collapse of the illicit market meant that people were trying to squeeze as much money out as possible in the time that they had left, which meant that there was more exploitation of workers. Oftentimes people who use drugs found work on cannabis grows, which are often remote. They might not know exactly where they are, have few connections to the outside world. And I heard really harrowing stories of exploitation and violence in the cannabis industry. And I think that, the market dynamics are not helping that, since people are fearing for their livelihoods. And I think that more broadly, I think people expected that legalization would completely quash the illicit market. It hasn't yet. There's still a lot of illicit cannabis going on, and it's still viewed, importantly, this is the important part, it's still viewed as a menace, as a sort of, in rural areas, often as a vehicle. It fits into the narrative of outsiders coming to the area to exploit rural communities, even though people who are growing and working in the industry are often locals, or from similar places at least, and as a vehicle for organized crime, often perniciously described as Mexican cartels with the specter of illicit organizations that were connected to undocumented immigration, and that sort of signaled the influx of sort of ethnic undesirables, essentially, into predominantly white communities. So I think it's a huge narrative. It's not the focus of my project, but I think it's going to continue to be a real important trend in rural California, with a lot of disparate effects. With respect to tribal courts and acquainted marginality, I didn't study any tribal courts. I think acquainted marginality is a pretty flexible concept. I think it can apply anywhere where you see these kinds of dense networks between people who have a lot of power and can exercise it over other people within the same networks and communities, whether that's a rural place, whether that's, for instance, you can read historically in ethnographies of urban immigrant enclaves where there's similar sort of social closure. It might not be policing as the institution that's exercising power, but you can see it in all kinds of other powerful institutions, healthcare, community-based organizations, religious institutions, anything that has an effect on the life chances of marginalized residents. And so, I would expect that to the extent that there are differences, there's inequality within a community that's densely connected in the way that small towns often are, that you might see similar dynamics. Though I do think that acquainted marginality intersects with other dimensions of inequality in important ways. So, for instance, differences in social networks in different ethno-racial groups, for instance, could shape the extent to which powerful and less powerful members of the community are connected to one another or not, the geography of inequality and whether people are concentrated into areas where they're likely to have frequent interaction or not, and the differences, say, in towns where predominantly white officials are presiding over largely non-white populations. You might also see intensified effects to the extent that racial animus and discrimination charges those relationships. And then on the third question, electronic monitoring, it wasn't a huge part of my field work. I didn't talk or spend a lot of time with people who are on electronic monitoring. I don't have a lot to say systematically about it. I do wonder the extent to which the same resource constraints that operate in other areas in small and rural police departments would limit its sort of use or efficacy. Like, even if they could put the anklets on people, the extent to which they can actually monitor or use that data, I think is probably in question in a lot of places. But I would love to hear what others who have studied the topic would say on that question. I think it's a great one.
Thank you.
Thank you. Yeah, I mean, I think that last hypothesis, David, is a good one. I know Josh knows from Josh's work here that even in a place that has a big infrastructure available for electronic monitoring, that there are days where the probation office will say, we're out of monitors today, so we can't actually let this person out of jail on a monitor because we don't have enough.
Right.
So yeah, those infrastructure concerns persist. We have a couple more questions in the chat so far. Lynn Miller has the next one, and then Jackie. Do you two want to ask those questions, and then you can take them back to back, David?
Sure.
You want me to unmute and ask it?
Yes, please. That would be great.
So thank you. I heard about this from the Harvard email that goes out, so I have no familiarity with your world at all, but really fascinating work that you've done, and I can see it being really valuable to every citizen. So my question may be like a real novice question, but you said at the end, by making the drug supply safer, it would actually help treat the addicts. And I'm sort of curious about how that works. Thank you.
Sure. Katie, should I take another question and then do them back to back?
Yeah, I think it makes sense to take these two together. One of them you've kind of already answered. Jackie, go ahead and ask your question.
Yeah, I'm just curious, and you may not even focused on this at all, but with the legal status of marijuana in the states that it's legal, right? Does that affect acquaintance, marginality, or your perception of me as an individual, because now it's legal and I'm using it legally and I'm not using any of the opioids, right? So does the legal status actually affect it? And I'm suspecting that relationship marginality is many more factors into it than just use or non-use.
Mm-hmm.
Yeah.
Great. I'll actually, Jackie, I'll answer your question first, and then Lynn, I'll answer yours. So, yeah, I think one of the things that you're getting at is the extent to which perceptions of a drug, and therefore the people that use it, depend on the legal status of the drug, and then the extent to which they depend on other social norms that have less to do with the legality of the drug. And I think that on the one hand, depending on where you're talking about, I mean, in a lot of places in California where cannabis has been a large part of the local economy and the local culture for decades, there's just kind of a baseline lower stigmatization of use of cannabis and of working in the cannabis industry and things like that than you might find in places where it's not as much of a factor. So what I would say is that even prior to legalization in some communities, simply being someone who uses cannabis was not likely to be a huge factor in your social standing because it was a widespread and relatively normalized practice. I do think that there's potential that the legalization of cannabis, which I think lags changes in social perceptions of cannabis, it's, lawmakers are catching up to population's views of cannabis as a less dangerous drug that should not be subject to criminal punishment. I think sure, legalization could change a few more minds, like insofar as like, oh, I really don't like breaking the law, so if the drug's illegal, I don't like it. Well, now that it's legal, I don't feel as strongly about it. I could see that working for some people. But I think for a lot of reasons, anti-drug stigma in general, beyond cannabis use, though maybe for some people, including cannabis use, it's pretty deep and long-standing in the United States. It has multiple sort of social reservoirs to draw from. And so kind of what I wanted to make the point at the end is that even if we can't fully address anti-drug stigma, even though we should try, what we can do and should do is decouple the effects of that stigma from legal and criminal consequences, which are extremely detrimental for people who use drugs. And that people might still be subject to reputational damage, discrimination in other contexts and things like that, but at least they would not be subject to arrest and incarceration for their drug use alone. So that's kind of how I see the relationship between stigma and legality, I guess, partially. Though the other thing I should say, the relationship between cannabis and opioids, I mean, there's a lot of kind of soft interest in cannabis as substitutes for opioids for some people. I don't think the evidence shows that cannabis can replace opioids altogether for pain management. But I do think also that, you know, insofar as cannabis is a less stigmatized, less marginalizing drug for people that I talk to, for instance, the defendant in Sage County that I mentioned, moving from using illicit drugs to using cannabis is a harm reduction move. It's a pro-social move. It signals that they care and are trying to, you know, take seriously their lives and yada, yada, yada. And so I do think that cannabis for some people certainly has a role to play in addressing opioid use as well. And then Lynn, your question is really important, and I'd love to explain a little bit more what I mean from that. So, or mean by that. So, first of all, even if our goal is that all people who use illicit drugs should get treatment and should quit using drugs, which I'll be upfront is not a policy priority of mine, is getting all people to quit using drugs. But even if that is our goal, in order to access those services, which often, you know, take multiple attempts and take a long time for people to be ready for, is the terminology that you often hear, people need to stay alive long enough to do that. And the state of the illicit drug supply is so potent and unpredictable that it's harder and harder for people who use opioids, and importantly are physically dependent on opioids. Don't just use them because it's fun, but because they have developed a physical dependence on the substances and need to use them, or else they suffer severe health consequences. They have no alternative but to use the dangerous and unregulated and unpredictable drugs that are sold in their community. They can't control what people are selling. Oftentimes the people selling at the street level don't even know exactly what they're selling and have little control over their supply. And so given that most people aren't ready for treatment, don't want treatment, and given that we know that coerced treatment often doesn't work and can lead to really negative outcomes if people sort of fail out of treatment and go back to using, it's important that people be able to stay alive long enough to get services. And so one component of that is providing people with a regulated supply that will be safer and easier for them to use predictably than what's available on the street. That can come, so program models that exist in other countries are more clinical, where people receive injectable opioids. They're more comparable in their effects to what's available on the street, but are regulated and less potent. Another model is sourcing and testing drugs and distributing them through compassion clubs, which is a model that was originally pioneered decades ago for cannabis. These are really early stage efforts. It's really difficult to even consider alternatives to prohibition in our society, in our legal regime, but I think it's really important to address the potency of the drug supply. And one other thing that I'd like to say on that, people who use drugs, even if they don't want to quit, and even if they don't want treatment, they don't want to die. They don't use drugs to gamble with their lives usually. People are interested in being able to use drugs more safely. That's why harm reduction services that's why they work, is because people are eager to use a new syringe rather than having to reuse one that might hurt their arm or might break off inside of them. People are eager to have naloxone on hand in case their friend overdoses so that they can save their friend's life. And so typically, like it's useful, I think, to see harm reduction services, including at the sort of, I guess, extreme from an American perspective end of a safer drug supply, as on a continuum of health and safety interventions, and is reflecting the same desire, along with treatment and other healthcare services, and reflecting the same desire among people who use drugs to stay alive, to protect their health, to lead happy lives, and to protect the people around them, which are desires that they share with most other people, most of their neighbors and others. Sorry for the long-winded response.
Oh, thank you for that, David. And I know I just dropped this in the chat, but wanted to, while you were on the topic of, Narcan, wanted to mention that officially the FDA has regulated it to be over the counter as of today. So that's big news in this field. Peter had a question that I think we have time for. Peter, go ahead and unmute and ask your question.
Hi, David. Yeah, I was curious, your findings, so regarding Ray and Alex, seemed largely consonant with labeling theory, in that they were labeled, as bad people and were treated as such. And I'm curious if your findings have anything, to add or change for that theory, and also how your term, your acquainted marginality, if that is also consonant with labeling theory or different in some way.
Sure. Yeah, I'm not contesting the labeling theory at all, obviously. Yeah, I mean, Ray basically named the theory almost in one of the quotes that I shared when he said that they label make you. This is a phenomenon that people recognize. I'll say, of course, it's not merely a label. I'm not arguing that Ray, Alex, and others, or the district attorney, the sheriff, etc., are entirely good and moral people who have never done wrong in their lives. That's not my contention. But it is true that labeling plays a big role. And I think if I had anything to add to labeling theory, it would be to introduce the importance of social network structure to who labels and how durable the labels are. So one thing that I think is unique in small towns is as I've reiterated throughout the talk, is this intermingling and overlapping of social ties and professional ties, so that your neighbors can also be people who have control over you in other settings, which creates links between the neighborhood and organizational settings that don't necessarily exist in large cities or might look different in large cities. So I think it's important seeing the intersection of social networks with organizations when it comes to how labeling actually works in practice.
Thank you for that. I think as we're wrapping up, I just wanted to end with a couple of questions and thoughts. One was, you gave a really concrete example of a plea bargain offered by a prosecutor that would require somebody to leave the jurisdiction, right, in order to get the kind of access to mercy that they were offering. And it struck me in part because I know that there are agreements like that have been enacted here in other jurisdictions, in particular around another public health problem involving a pretty different population around gun violence, and in particular the way that the police engage in criminalization of social networks around groups that they label as gangs, and that people have been offered deals or had charges dismissed or cases dismissed only upon agreement that they will leave the jurisdiction. So I think you do a really excellent job in the paper and in this presentation of showing the particular context in rural small towns. But I think the notion of the way that social networks are used and mapped by law enforcement, even if there isn't that same level of acquaintanceship, might still apply in other contexts. And I wonder if you could talk about kind of like, you identify some other future directions for research that could build off this theory. I wondered if you could just give us a tease of that.
Sure. Yeah, I mean, I think, like I said in response to one of the earlier questions, I think that dynamics similar to what I documented in these very remote places certainly operate in other contexts. And similar tactics are certainly in use in different contexts. And regulating access to space, as lots of other scholars have argued, is a pretty essential part of how policing happens these days. I guess I would say, yeah, that really that I'll say what I can say from my field work, and I'll be interested in if this resonates with with what you know, Katie. But I think that in rural areas, it reflects a view, which is in part borne out by the criminological literature, that a large proportion or a significant proportion of the offending in a community is the responsibility of a relatively small number of individuals in the community, whether it comes to gun violence or other offending. That officials have this perception that in the small towns I studied, that these people are not really part of the community. They're not really community members because they are, aggressing against the community in some way. They often have a perception that they're actually outsiders who move to the area to take advantage of the services in the area. And they think that if they can simply get that small group of people to leave, then that will solve the crime problem. And while certainly network dynamics are really important in, patterns of gun violence and patterns of other criminal activity, I think what that overlooks, of course, is that there are structural reasons why marginalized individuals are at higher likelihood of engaging in illicit activities to make money or for other reasons, and that it's less about the specific individuals that are committing crimes at a specific moment, and more about addressing the conditions that are likely to lead people who are going to be in their similar situations in the future into doing the same thing. I think the part of the going back to drugs, which is really what I focused on here, and that's why I sort of emphasize the effects of acquainted marginality on people who use drugs specifically, though of course I think it extends to other groups of marginalized people. Part of what the overdose crisis, coverage of the overdose crisis has, I think, gotten wrong is to suggest that drug use is a novel phenomenon. Illicit drug use is a novel phenomenon in rural areas, that rural areas were immune to drug use prior to the overdose crisis, and that's simply not the case in lots of times in lots of places with respect to lots of substances. And the idea that this is a temporary problem that can be completely eliminated merely by removing a few bad actors and then things will go back to how they used to be, I think is unfortunately, because of some of the structural dynamics I described, mistaken.
100%. We usually, our traditional speaker series events go until 1:15. So if you've got a few more minutes, we don't have other questions in the chat, but I have one more question that I would love to hear your thoughts on, which is you mentioned one example in the paper of the probation officer saying that they kind of look away potentially when they're off duty, right? And try not to see things that might otherwise trigger sanctions that they then have to enforce. And I wondered if there's any other examples you came across in the research where the nature of the acquaintanceship, the durability of relationships actually was something that was a boon to people who would otherwise be criminalized. Because I think often we think of that certainly in wealthy social networks in the way that race and power and privilege and socioeconomics can impact people for positive when there's acquaintanceship within systems of power. So I just wondered if you could speak about that too.
Absolutely. I mean, I focused on one town here, though I saw largely similar things in other places, other communities I studied. Just another concrete example that I can think of in another county is a district attorney whose neighbor grew cannabis and who had like large, tall cannabis plants, essentially like leaning over the neighbor's yard, like onto his property, the district attorney's property, and that he sort of let that slide. Again, I think because cannabis was not perceived as a super criminogenic substance in that place, and also because the district attorney didn't particularly want to try to arrest and investigate his neighbor, I think is the other subtext there. And I did observe in some counties cases where empathetic relationships, like I kind of mentioned, facilitated understanding and progressive policies from local leaders. So other small counties where, say, a respected local resident could speak passionately about the importance of looking out for our neighbors who use drugs, and can frame interventions as a way that we show the kind of reciprocal care to our neighbors that is often important in rural areas, alongside their the emphasis on self-reliance that you often find there is looking out for your neighbors rather than relying on the government to do so. And so in some cases where there were respected people in those positions who had, for whatever reason, empathetic connection with people who use drugs, you could see progressive outcomes. I think that the problem, or not the problem, but the distinctive feature of small communities is that because there are fewer people in positions of power, the local policy outcomes are more heavily influenced by the individual personalities that occupy those positions. And since each individual has more influence, proportionally, than they would in a large urban bureaucracy, for instance, I think that a single person can cause a lot more dysfunction if they're unwilling to go along, or if they have poor relationships with their colleagues, than can be the case in urban areas. And so I don't mean to suggest that things in rural areas are always bad, nor are they always good. Really, it's just to point out kind of the structural fragility of small communities makes them more susceptible to individual whims, which, insofar as rural communities are often more conservative and feature the kind of anti-drug stigma and animus that I described, it's going to lead to less progressive policy outcomes as a result.
Thank you for that. It looks like we've got 2 more questions, and then I think that's probably enough to get us to the time. So Kathy, it looks like you've got a question. Do you want to unmute and ask that? And then we'll go to Tim.
Yes, thank you, David. I've just enjoyed this talk a lot. Could you remind me, I know I studied it, but remind me a little more about labeling theory and just give an explanation of it. And then the part 2 of that question is, what does change the durability of, you've said a little bit like a respected person speaking up for you, but like I'm thinking of sometimes kids that are gang involved in Boston, or young people who are doing stuff, or even returning citizens, the label sort of stays with them. And how can we first explain labeling theory, but then the second part is, how can we help with the durability of labels?
Sure. Just very briefly, labeling theory kind of starts from the insight that what is labeled deviant or normal is not constant over time or place, but depends on the sort of social norms and expectations operating in a given community. And that often what divides people perceived as deviant from those perceived as normal is the application of the label of deviant, which causes people to treat them differently, and also often causes people to reconfigure their own kind of self-image and identity in response to being labeled as such. So it can actually kind of reinforce divisions between so-called deviant people and so-called normal people. So that's just the basic insight, is that in addition to people's behavior, the labels and responses that they receive from organizations in their community have a lot to do with their status and standing in their community. And yeah, so in terms of what affects the durability of those labels, I think it's a lot of factors. I think one thing that happens in small towns is that if it's the kind of town where people grow up there and live there and raise children there for multiple generations, that perceptions about not just individuals, but about families, family names, can be extremely durable for decades. And that people can often from birth be labeled with the same kind of reputation that their parents or older relatives had. So in another county, that's something that I observed really clearly with a young man whose grandfather was killed by law enforcement, and whose family since then had essentially been seen as part of the usual suspects in the community, and who were easily identified by their shared last name. And so I think that that's one factor, is the how long-standing relationships are in the community, how much turnover there is in the community, the extent to which you can lose like your recognition in a place over time. Another thing is, I mean, it is a real strategy for people to pick up and move elsewhere and try to find a place where they aren't as well known, but that requires resources to do so. In rural places, it requires a car. It requires a belief that you'll be able to find work and a place to live in where you end up. And so that's a really limited escape option for a lot of people.
Yeah.
And then the last thing I would mention is the extent to which reputational damage is tied to organizational consequences, like formal institutional consequences of the labeling. So what's kind of important in the context that I studied is that a person who, for instance, showed up in an emergency room, there's a good chance that the healthcare provider that treated them might already know who they are based on them being in the paper or gossip about them, or having lived in the same town with them for a long time. Whereas that's less likely to occur. It could certainly still occur in an urban area, but it's less likely to occur that if you show up at your local ER, that the physician is going to have been hearing about you since you were a child or something like that.
Yeah. Thank you so much.
Yeah. Mhm.
Oh, I didn't cut you off, did I?
No. That's
Oh.
all I had to say.
Okay, great.
And last but not least, Tim, go ahead and unmute and ask your question.
Hi, David. Thanks for this super
Hey, Tim.
rich talk. I'm thinking back to the figure you showed at the beginning of the presentation from Vera on like pretrial rates.
Yeah.
And I was wondering if you could talk a little bit more about how jails fit into this story. That was my question. Thank you.
Absolutely. So I should also say I use those figures as a very rough indicator of the trend, which several scholars have documented, of continuing increases in rural arrests and incarceration for drug offenses and for other offenses, even as we've seen plateaus and modest declines in incarceration that are really driven by large cities and by progressive states. And so the role of jails, I think my answer, it'll be distinctive in California, because there are things that have happened over the past 10 years plus in California that are different in other places. So California has seen a large drop in their state prison population, in large part because they made the decision to simply rehouse large classes of offenders in local jails rather than send them to prison. It's called a policy called realignment. And so during my field work, the sheriffs who ran rural jails they complained about realignment because it was essentially forcing the state was forcing them to take care of more people, to look after more people. And it caused all kinds of challenges because jails, especially small jails, are not set up to house people long term and provide them with the care that they need long term, and lots of other issues. And what that meant is that jails were pretty full. They often wouldn't, they couldn't hold people pre-trial unless they were accused of serious offenses. So people were often booked and then shortly released. That wasn't always the case. I know of, I can think of one participant of mine who, I think in part because he was seen as a usual suspect, they kept him in jail quite a long time. But it was definitely, I think that, a lot of rural, and this contributed to kind of the punitiveness. I think a lot of rural sheriffs, because of their increased responsibilities after realignment, wanted bigger jails. They wanted to increase their capacity to incarcerate, to kind of keep up with demand. And of course, if jails are there, then they're likely to be filled. And I should say that even if people aren't incarcerated for long periods of time, pre-trial or otherwise for drug offenses, there are a lot of moves to try to reduce sentences that people would receive for simple possession in California during my field work and after. Even being incarcerated in jail for a short period of time can have significant effects on a wide range of life outcomes. Sandra Smith has worked a lot on this topic. She's really an expert on it. And that's the same with drug use. I mean, opioid tolerance changes significantly even within a day or two or three. And depending on the person, of course, and how much they used and other aspects of their situation, even being briefly incarcerated could have pretty serious effects on their overdose risk after they do get out of jail.
Thank you for that. I think that's an important note to end on that ties back into broader work being done here, research projects that Sandra has right now, looking at how even one day in jail can have seriously dramatic consequences for somebody's life. So we'll keep everyone posted on that project as it becomes available. But in the meantime, thank you so much, David, for this talk. I know it was really a great discussion and everyone has been very engaged in the chat. So to be clear, we will make this posted on our website once it's the video is downloaded. And David, if you're able to make your slides available too, that would be wonderful that people could have them. But that is totally up to you. So,
Okay.
and thank you, everyone. And we'll be back next 2 weeks. April 12th is our next event.
Thanks, everyone. I had a really great time. Thanks so much.
Take care.